There's a growing mental health crisis in our country and in our state, and it's particularly acute in young people, including college students. About 75% of the mental health and behavioral health issues emerge in the population between the ages of 14 and 24. College students, roughly on our campus, are between the ages of, say, 18 and about 24. So the University of Rhode Island, we've seen evidence of this growing crisis. Some of it relates to substance abuse, but also other forms of mental illness as well. And at the University of Rhode Island, we feel strongly that it's our responsibility to protect our students, to help them. And in so doing, we needed to identify a mechanism that allows everyone in our community to become aware and to perhaps be able to visualize the symptoms of a student or any individual on our campus who's under stress or having difficulty. I'm part of the steering committee of a group called Healthy Bodies, Healthy Minds in South County. And as I sat on that steering committee, I learned about a program called Mental Health First Aid, which was being implemented in various communities within Rhode Island. And working closely with my colleague, Vice President Kathy Collins, who oversees our student affairs, we jointly decided and found some resources to bring the national program to the University of Rhode Island. Maybe the most critical element of this was 12 staff members in our community who are gainfully employed on campus doing other work were willing to dedicate a week of their time to be trained on our campus so that they could become trainers in the mental health first aid program. Those 12 individuals, in my view, deserve just a ton of credit and acknowledgement for their leadership and their commitment. That all happened this past spring, and we implemented mental health first aid trainings on our campus starting roughly August 1st of this past summer. At this point in time, we have trained about 350 individuals, adults on our campus, including myself and the Vice President for Student Affairs and our entire offices. And by the time this semester ends, we will have trained somewhere in the range of 460 or 480 adults in our community. The program largely sensitizes us to the mental health issues and symptoms that might be taking place in members of our community, and gives us the resources to guide and advise those individuals, and mostly to refer them and ensure that they get help from the resources that we provide here on campus.